All right, Madeline, thank you very much. It's 8:34 right now. This week is Eating Disorder Awareness Week. And joining us live this morning is Dr. Mary Romano, a professor of Pediatrics, Adolescent, and Young Adult Health at Monroe Carell Jr. Children's Hospital at Vanderbilt. Dr. Romano, good morning to you. Let's start with this. What are some of the warning signs for eating disorders in young people? So speaking specifically here to parents.
Sure, absolutely. I mean, I think the most important thing is to always trust your parent gut. If you are worried, you're probably on the right track. But I think anytime you notice a change in your child's eating habits, so perhaps they're starting to skip more meals than they used to or refuse foods that they used to like, if you see a child, especially an adolescent or a young adult, consistently make comments that are disparaging about their body or their body size, I think that should be concerning. And then I think when we think about younger kids in whom eating disorders might look a little different, you know, all kids, all toddlers in particular are picky eaters. We've all seen our kid who will only eat one brand of mac and cheese or one type of fruit that has to be the right, you know, color and texture. If that persists and begins to make eating just more and more challenging and stressful, I think at the very least, it's worth having a conversation with your teenager. It may be harder to have a conversation with a younger child, and a conversation with your pediatrician. And I think anytime you notice that your child's growth is affected, so either they've stopped gaining weight, they're not moving forward with weight and height growth like you'd expect them to, or in adolescence, they're not moving forward through puberty like you might expect them to, or for girls, if there's a change in their menstrual pattern, I think those are all signs, again, that at the very least, you trust your mama gut or dad gut, and you have a conversation with their primary care provider, their pediatrician.
Dr. Romero, very quickly, I wanted to ask you, oftentimes we think of eating disorders as children or people not eating. What about people who are overeating? Is that also an issue, and is also something that people need to be watching out and aware of?
Absolutely. I mean, I think, you know, eating disorders in general are your inability to fuel your body in a way that promotes healthy growth and development. So I think anytime someone's consistently eating more than they should, again, kids and adolescents are growing, so I think that's not atypical. But I think if you often see a child going back after their meals to eat food, or if you notice large quantities of food are missing, or perhaps you find wrappers or like evidence of old food in your child's bedroom, I don't know that you have to panic that they have an eating disorder. But again, I think it's worth having a conversation like, hey, I've noticed you're eating more than usual, or I've noticed that when you're sad, you go into the pantry and you get food. Like, let's talk a little bit about what that feels like for you. You obviously don't want to approach it as, hey, you're eating too much, because you don't want to sort of make a child question their innate sense of, here's how I know when I need to eat, here's how I know when I'm full. But I definitely think it's worth having a conversation
that intuitive eating, I think, is what you're speaking to, Dr. Romano, which is something worth pointing out too for adults, even that intuitive eating. So thank you so much. We really appreciate your time. We got to wrap it up here.
Eating in adolescence can be a little bit of a challenge, but yes, I mean, I think you just don't ever want to approach it as you're overeating, you're undereating. It's more, tell me about why you're eating the way you are.
Okay, thank you so much for your time. We appreciate it.